Hey YouTube, it's Eliana from A Day in My Sleep. So, I haven't updated in the longest time. It's my same old excuse. This time, putting a stop into it. I feel that this time feels different. I've had enough. I've had a major regain, and that is what I want to talk to you guys about. But let's go to stats first. So, I had VSG surgery. I have this cool little application that tells me exactly how many times and whatever. I had VSG surgery on Wednesday, February 8th, 2012. Today is Friday, October 24th, 2014. So that was 989 days ago. And if we're going to calculate weeks, that was 141 weeks ago. So I am 141 weeks post-op VSG surgery. The lowest, I started off, well, it's kind of weird. If you guys have been following me, you guys know kind of my story. I think the highest weight that I ever reached, but I wasn't even getting on scales, this is just the documented highest, was 296 pounds. And I know I was dieting before they weighed me, so I think I actually hit 300, but anyway. When I lost weight by myself, I got diagnosed with cancer in 2010, 2011. It was like that cusp. Had surgery January 2011 for my cancer in my leg, was in a wheelchair, and I regained, and then the VSG surgery came in my life, weight loss surgery came in my life. I had to lose 10% of my body weight in order to qualify with Kaiser for my surgery. So going into surgery, I was weighing 240, 241, like something like that. And then I've actually gone down to, my lowest weight has been 160 pounds. I never got to see the 150s. I think I was 160 for like one day. Otherwise, I was very happy in like 163, 166 for the longest time. And now I have gone as high as 177. Right now I am weighing between 174 and 175. Just weighed myself this morning. I'm 175. I started last month with a trainer, a different trainer, because my old trainer I've moved like several times. I'm in a new apartment again. And so anyway, so I started seeing this new trainer. He's super smart, super, like, we totally relate. And his name is Sage, so if you guys hear me talk about him, just know that's my trainer. And I've seen him for a month now, and I actually, like, it's frustrating because I lost maybe like 2 pounds in a month. Crazy. And it's not because he's not doing his work. It's me that I'm not doing my work. So, and it's also crazy because I lost, I think, almost 2 inches, basically all around. My butt's a different story, so I think I just lost one inch in my butt. But I lost inches during that month. I didn't necessarily lose weight. Now, I can be in denial and say, oh, you know, it's losing inches, blah, blah, blah. If I was doing my part 100%, I would have probably lost weight. But I really wasn't. I started watching what I was eating a little bit, but honestly, like, my caloric intake was way up there. And I would have ice cream at nighttime, and I would eat carbs galore, and the list goes on. You know, I totally derailed when it comes to food. Totally derailed. Obviously not as bad as before because I cannot possibly fit that amount of food, but I found myself making awful food choices, and grazing a lot, snacking a lot, enough to get that caloric intake to go up there. And basically, I've been working out with him, going to the gym, doing Zumba, like salsa classes, and doing cardio on my own. But, you know, you exercise, you do get hungry, but instead of making good food choices, I've been making god-awful food choices. So now, like, I saw this really good video on YouTube. I think her name is Mama Mia. And I think she's post-op, not even a year, maybe a year. But she basically wrote a letter to herself. And what she said in that letter, you know, even though we're in different parts of our journey, we are post-op VSG. It doesn't matter if it's a year, a month, whatever. We all have that mind struggle, that inner fat person coming out, and, you know, head hunger life. Sometimes you lose momentum. It could be a combination of everything. It could be depression. Whatever it is that is setting you off to derail you from your goals, like, we all have something in common, you know. We're big for a reason, very similar reasons. We all have in common that we had weight loss surgery, and most of us have in common that we do have a regain, whether it's a 5-pound regain, 10 pounds, 15, 20, so forth. We all have a regain. I've been told about this regain. Maybe not everybody has it, but I know several people who've gone through regain. Doesn't necessarily make me feel better. It reminds me that I am human. But now it's up to me to actually do something about it, get back on the bandwagon, and, you know, face the music and give it my all again. Not even 100%, but like 150%, you know, like give it everything. And it's time for me to own up to what I've done. I mean, I can blame it on, you know, depression, having, you know, my partner move in with me, like my job, family, like, I can blame it on all these things, and yeah, they do take a big part of it, but in the long run and in the end, it's me, you know. And I had a big eye-opener at work the other night. Like, I was stressed out, and usually I eat horrible when I'm at work, but I was really stressed out, and, you know, there was M&Ms, like a bowl of M&Ms, and like snacky foods like chips and stuff like that, and I did have some, and it's sad because, like, my coworkers will, I can only imagine what they probably think, you know, like, oh wow, she was really diligent in what she was eating before, and now she's like out of control, like eating whatever it is that is out here. And then so I had that, and then my boss brought some red velvet cupcakes. I ate half of one. And then 15 minutes later, when I was leaving, you know, some student nurses brought donuts. And of course, like, I had half of a donut. Like, seriously, I did not need to eat that. I wasn't hungry. And then I went to go have breakfast with coworkers. I mean, I wasn't hungry. I didn't need to eat that. I had appropriate snacks in my bag. I just made the wrong food choices. And it's time for me to wake up, smell the coffee, you know, and just fess up and own it to myself that I am the one that's making these awful food choices, and I really just need to sit back, have a plan, which I do have a plan, and follow it, you know, because if not, what's going to happen is I've had 12 to 15 pound weight gain, and it's going to, you know, first it was 5 pounds, you know, which I was comfortable with, you know, then it was 10, and now it's like 12 to 15, you know. Before I know it, the holidays are going to be here, and it's going to be a 20, 25 pound weight gain, and it's not cool. And for the population in the VSG family, or weight loss family, who suffers also, this is like a girl problem. with polycystic ovarian syndrome, I don't get my period often. And when I was down to the 160s, I was getting my period often. You know, I was getting it every month. Maybe not like on point, but I was getting it very often. And now that I've gone into the 170s, I am not getting it at all. Like the last period I got on my own was in May. So, I mean, if I want to start a family, when the time Lewis and I want to start a family, like, it's not going to happen because I'm not ovulating. I'm probably going to have to go through fertility treatments. And what is the first thing that a physician's going to tell you? You need to lose weight. I need to get this under control, not just for myself right now, but for my future as well. So, you guys, I am drinking my water. It is water. I had to put sweetener in it or whatever because I'm really bad at water. But I'm drinking my water. I'm increasing my protein intake again. Right now I have salmon cooking. And I am going to get back on track, guys. And, I have a couple of things coming up, like my cousin's wedding, bachelorette party. Like, I have a couple of things coming up. But I am going to do my best to at least check in. So right now I am weighing 175 and exercising with my trainer and exercising on my own. So I'm going to check in next week and see how I'm doing. Good luck to everybody who's experiencing regain, and good luck to everybody who's currently or will be going on their journey. Love you guys. Bye.